Haploidentical is a relatively newer form of transplant. As I understand it, the research really was established in the early 2000s. The diversity is really a very significant barrier. And just to underscore, as of 2020, over half the marrow donors in the US registry were white. The exact numbers were 54%. 9% were African American, 11% were Asian, and 16% were Hispanic and Latino.
Those statistics are staggering when you look at just exactly what you've said.
Yeah, I hope I inspire others to learn more.
I think you definitely will. You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS, and today we are joined by ONS member Naomi Cazeau, nurse practitioner at Memorial Sloan Kettering Cancer Center's outpatient bone marrow transplant unit in New York City, and member of the New York City ONS Chapter, to discuss haploidentical stem cell transplants to increase transplant eligibility in people of color. Thanks for joining me today, Naomi.
Thanks for having me.
So to start us off, can you just explain to us what are haploidentical transplants and what would make a donor for a haploidentical match?
I think a good place to start is by explaining what is meant by matching. When we talk about matching a donor to a transplant recipient, we talk about matching them along HLA, or human leukocyte antigen. Human leukocyte antigen is a type of molecule found on the surface of most cells in the body that play an important role in our body's immune response to foreign substances. Two major classes of HLA referred to in transplant include Class 1, which are A, B, and C, and Class 2, which include DRB1, DQB1, and DP1. In general, an 8 out of 8 matched transplant is matched along A, B, C, and DRB1, and that constitutes a full match, which is the most ideal type of match. Haplos are a relatively newer type of allogeneic transplant, in which donors are half-matched to their recipient, and they're typically relatives, like a parent or a sibling or a child.
You kind of were mentioning about the HLA typing and matching donors. So when a matched donor is not available, can you explain a little bit more about a haploidentical transplant and a mismatched, unrelated donor transplant?
Sure. A mismatched donor is generally mismatched only at a single allele or antigen, which makes them a 7 out of 8 match as opposed to an 8 out of 8 match. And as I had said earlier, a haplo is matched at much less than that, at only half. In terms of preference, haplo donors are available more quickly or more quickly accessible than a matched unrelated donor. And while there is a progressive decrease in post-stem cell transplant survival with each HLA allele mismatch, the absolute decrease in survival with each allele mismatch lessens as the urgency of transplant increases. Therefore, if the risk of relapse is high and the chance of finding a perfect match is low, then proceeding with a known mismatch or alternative donor like a haploidentical donor may be preferable to a lengthy search for a full match. As far as a preference between mismatched or haplos, it really depends on the patient and what their specific needs are, as well as the care team and where they are regionally and what they can get access to more quickly. There was a meta-analysis published in JAMA Oncology in 2019 that showed haploidentical stem cell transplants with post-transplant cyclophosphamide for GVHD prophylaxis appear to have better outcomes in terms of mortality, relapse, and GVHD compared to mismatched unrelated donors.
That's really interesting. I think that, like you were saying, the urgency of needing a transplant for patients is definitely something that will, let's say, push the decision on what type of a match donor you're going to have for the transplant. And I think it's really important to understand that, especially in patients that are waiting for a transplant, and as their disease might progress or things get more serious, and the search is taking a little bit longer than planned, and what those options might end up coming up that they would have. So you've explained haploidentical and mismatched unrelated donors. Can you talk to us a little bit about what some of the common complications with a haploidentical transplant might be that a nurse would have to look out for?
Certainly. I think the most common complication, and certainly one of the more serious complications with a haplotransplant, is an inflammatory reaction called cytokine release syndrome, or CRS. CRS is an inflammatory response that can occur when activated lymphocytes and innate cells release inflammatory cytokines that can result in fevers and end organ damage. It can occur with any peripheral blood or bone marrow transplant, allogeneic transplant, that is, but it is most common among haplotransplant recipients. Usually, this reaction occurs between the day of transplant, or what we call day zero, and day plus 5, or 5 days after the transplant infusion. It's often mild, but more severe cases can be associated with poor transplant outcomes. And I had mentioned earlier, haplotransplants often receive post transplant cyclophosphamide. We all know cyclophosphamide as a chemo agent used to treat disease. But in this setting, it's used at a different dosage to prevent graft versus host disease. And what's interesting about the post transplant cyclophosphamide is that sometimes with that alone, that can help to attenuate the reaction of cytokine release syndrome. There are other immunosuppressants that are used to treat cytokine release syndrome, including tocilizumab.
That's really amazing that we've come so far in transplant that by administering cyclophosphamide, like you said, afterwards can help to decrease, the issues that they would have with a haploidentical transplant. Can you talk a little bit about how that differs for a mismatch unrelated transplant?
Yeah. So with haplos and mismatched unrelated donors, one of the risks are graft versus host disease, as it is with many forms of allogeneic transplant. The risk is a little bit higher with the mismatched and the haplo because of the level of discrepancy at the HLA level between the donor and the recipient. But what's interesting is with haplos, you might think that the risk would be greater because they're only half matched to the recipient. But with this post transplant cyclophosphamide, the research has shown that the risk of graft versus host disease has been greatly decreased. That risk still exists with mismatched unrelated donors. And what's interesting is that there are studies ongoing that show the use, or that are looking at the use of PT-Cy, or post-transplant cyclophosphamide, with mismatched unrelated donors. But mismatched unrelated donors are also typically prophylaxed for graft versus host disease, much like allogeneic transplants are generally, with medications like tacrolimus or sirolimus or mycophenolate. And so we'll talk a little bit more about statistics and risks compared between haplos and mismatched along the lines of graft versus host disease. But while they both have that risk, I think what's been interesting about research recently is that the use of post-transplant Cy has helped to decrease the risk in the haplos, where it was typically much higher.
That really is amazing. And also, that's really great information and great results that the data is showing for patients that are having the haploidentical transplants, where in the past that may not have even been the best option for them. But with these new results and the information coming out, that is just really promising for patients. So let's talk a little bit about the securing a donor. How challenging is it to secure an unrelated donor for a stem cell transplant patient?
Well, according to the National Marrow Donor Program, or the NMDP, about 70% of patients in need of hematopoietic cell transplantation do not have a fully matched family donor and need a transplant using an unrelated donor or cord blood unit on an unrelated donor registry. Currently, the chance of having a matched available donor on the Be the Match registry ranges between 29 to 79%, depending upon the patient's ethnic background. For example, a white person has 77% chance of identifying a matched donor. An American Indian or Alaska Native have about a 57% chance. Hispanic or Latino patients have a 46% chance. Asian and Pacific Islander patients have 41% chance, and Blacks have only a 23% chance of finding a matched donor.
Those statistics are staggering when you look at just exactly what you've said.
Yeah.
So, what are the barriers that people of color who require a stem cell transplant face? Just like you said, with the statistics being 20 in the 20% range, why, and what are these barriers that they're facing?
Well, the biggest barrier is that people of color make up a small percentage of all donors. And the National Marrow Donor Program has really been trying to address that disparity through social media and community outreach programs. They also have research ongoing, like their most recent study called the Access Trial, which showed the use of mismatched unrelated donor transplants with post transplant PSI as an effective and safe approach to expand the transplant options for diverse communities. So their efforts are really being made to try to bridge these gaps, but this disparity is really a very significant barrier that needs a lot of attention.
So, you talked about some of those strategies that the National Marrow Donor Program is using. Are there any other things that you know of that, whether it's hospital systems or different things like that, that are using to reach that community and reach people of color to try and increase those numbers?
Yeah, I think that's the greatness of the research behind these alternative donor sources, such as the haplos that we're really focusing on today, in addition to mismatched and umbilical cord. I know at my center there's been research also that's ongoing on social inequities and disparities and their impacts on transplant and transplant outcomes. And I think getting as much research out there into the public is only going to help to inform people about these disparities and help to hopefully inspire more people to get involved through donation and just furthering the outreach.
Yeah, I think you're right. I think that's so important. And just finding ways to get into those communities and get that information available to try and help increase those numbers is so important.
Absolutely.
So now we're going to go back to the haploidentical transplants. Are they being performed for people of color at a higher rate than their white counterparts due to the statistics that you just shared with us?
Well, actually, Stephanie, recent data from the Center for International Blood and Marrow Transplant Research, or CIBMTR, showed the rates of unrelated transplants overall were significantly lower among African Americans compared to their white counterparts. And that's at a rate of 6% versus 76%. So we know that on the whole, transplants are being done at lower rates among people of color. However, there are studies, such as a 2019 study of over 1,000 patients at Memorial Sloan Kettering that were transplanted between 2005 and 2017, that showed 57% of patients without available matched, mismatched, or cord blood grafts, many of whom went on to receive haplotransplants, were of African descent. And this finding has been mirrored in other single center studies throughout the US, showing Blacks comprise a large portion of haploidentical recipients, if not a higher rate. So I guess overall, they may not be getting transplanted at a higher rate than their white counterparts, but of those who are transplanted, they make up a large portion of those receiving haplos within various centers.
That's good information to know. I think that the way you kind of explain that is extremely helpful. Not necessarily the higher rate of transplants per se, but maybe the higher rate of the product. that they would be getting.
Exactly. Or within an individual institution, it seems that data shows that at least at various single centers who have published within various programs, members of the BIPOC community make up large portions of those who are receiving haploidentical transplants.
Very interesting. So, can you elaborate on the outcomes of the BIPOC population? That's the Black, Indigenous, and other people of color population with haploidentical transplants.
Sure. I think a great way to explain it is by highlighting a 2018 single center study that was done on 123 whites and 80 Black patients who received haploidentical transplants with post transplant Cytoxin that showed Black patients achieved significantly superior overall survival and disease free survival compared to their white counterparts. There was also a trend toward greater relapse free survival among Black patients in this study, though this trend did not reach statistical significance. In 2020, there was a study comparing outcomes among Black recipients of either umbilical cord or haplotransplant, and it showed a lower incidence of acute grade 2 to 4 graft versus host disease and lower transplant related mortality in the haplo group. And I think that these findings definitely help to support the use of haplotransplants as a viable option for Black patients with limited donor options.
That is some really amazing data. Just to, be able to compare the two groups and their outcomes, but like you said, just to be able to show that that is a viable option, because I do feel like in the transplant community of past, let's say, haploidentical transplants, or, the mismatched, unrelated, I can, personally, from my experience, I can remember when we were not able to find a matched donor and we started going down the path of, either haploidentical or a mismatched, unrelated. Oh, that was just, your heart sunk a little bit just thinking about what the outcome might be, and don't knowing that this is the only option for some of these patients. And with this new information, I think that, that really does provide a lot more hope, and, just thinking that, okay, these are some really good outcomes for folks who sometimes have some really, really bad diagnosis.
Agree. And I also know anecdotally, I've heard from colleagues of mine who don't work in transplant, but who have some of their patients referred to our service. And, they'll kind of say, sort of downcast, like, oh, my patient's going for a matched unrelated donor or a MUD or a mismatched. And they worry for their patient that they're going to have worse outcomes because it's not that fully matched sibling related donor, which is sort of the gold standard or at least the most preferred. But I think what this data says to us is that, these other transplant alternatives are not necessarily lower grade in terms of the outcomes that patients can achieve with them or the risk that's inherent in them. And I think that's very important for nurses to understand. Hopefully, this data provides them reassurance that if their patient is going to undergo a haplo or a mismatched or cord, that doesn't necessarily mean that their outcomes are going to be any worse really than with the matched sibling related. And I think that that's an important message to get out there.
I agree with you. That is a really important message, not only to healthcare providers, but also to the BIPOC community, because I think that could possibly increase their willingness to be part of the donor registry. And speaking of that, you had mentioned, the National Marrow Donor Program. Can you talk to or speak to maybe what are some of the limitations that they have in finding unrelated donors for stem cell transplant candidates?
Well, yeah, again, it's the diversity is really a very significant barrier. And just to underscore, as of 2020, over half the marrow donors in the US registry were white. The exact numbers were 54%. 9% were African American, 11% were Asian, and 16% were Hispanic and Latino. So a huge disparity. And there's also additional constraints due to COVID. Last year, the COVID pandemic, which we're certainly still grappling with, really limited the amount of donations that could occur. For a while, it was fully placed on hold just because of the risks. And so we're still trying to recover from that. And I think that just added an additional challenge to the number of donors that we have within the system, particularly those of color.
That has definitely caused such a challenge. And just hearing from folks at the National Marrow Donor Program, even how things were affected with getting those products from unrelated donors or from other locations, and how that really affected the whole transplant process over the last year and a half. It has definitely been significant. So, in talking about the National Marrow Donor Program and how they are trying to do outreaches to increase those numbers of the BIPOC communities. Do you know, or are you aware of any of the public health efforts that have been successful in recruiting donors?
Yeah, I know a couple of years back in 2012, actually, Robert Roberts from Good Morning America teamed up with Be the Match on public service announcements that were advertised on the air. And I think that that was a huge recruiting effort by Be the Match. And aside from that, I haven't heard of many others that have gained as much ground as Robin Roberts and the Be the Match Foundation have. But there are on social media, such as Facebook, different groups that are out there trying to get the word out about the need for stem cell donors in the BIPOC community and trying to target the BIPOC community to get them involved. But I definitely think that this is going to continue to be a heavy lift. I think even this podcast is a great way to put outreach into the community and to try to inspire people, to inspire others. Perhaps more oncology nurses can continue to get the word out within their own local communities about this need and, do everything that we can to try to put the word out for the need for more donors. And I think nurses, especially because we have so much trust within the community, is important because, of course, within the BIPOC community, specifically within the Black community, there is a great deal of mistrust, towards the healthcare system for various reasons. And I think getting information from trusted sources like nurses will be huge in terms of encouraging more people from the BIPOC communities to think about donating to help those in need.
I agree with you. And I think with the statistics that you shared with us today, I was surprised at those. And I'm sure that the nurses who are going to be listening to this probably have not heard those numbers either. And so whether they take those back to, like you said, to their units or to community outreach that they're involved in, or something that their chapter could do that would be in those communities and to increase awareness to help grow those numbers, would just be tremendous. And I think, unfortunately, when there is a patient from the BIPOC community who is in need of a transplant, that sometimes those are the reasons why those numbers kind of have an uptick in going into the registry. But just to even get the word out before someone is in need to help increase those chances for folks is just so very important.
Absolutely.
So, what key points should oncology nurses understand about unrelated versus haploidentical transplants? And I'm speak to not only new nurses coming into transplant, but like you mentioned, some of our colleagues who are the ones sending their patients to to the transplant programs. What kinds of things should they understand?
Yeah, I think the most important thing to understand is that both unrelated, mismatched, and haploidentical transplants, as well as cord blood, because I think cord blood transplant is also in that conversation about alternative donors that help to bridge these gaps for members of the BIPOC community. But I think the important thing to understand is that they are all associated with risks and complications, but not necessarily one more than the other. And it's also important to understand that these alternative donor sources expand access to transplant for those in need who have limited donor options. And so I think it is important to keep that in mind and to not necessarily feel worried for your patient just because they're going to undergo a haploidentical transplant. Because as I mentioned, in terms of the data that's out currently on haplos, the research that's been done, including research, holding mismatched and haplos head to head, haplos don't necessarily come in worse. And in some cases, they actually show remarkably good results for patients.
Yeah, that's good. And I think those are some really good points for nurses to be able to understand. Can you tell us, is there additional training or education that oncology nurses need on haploidentical transplants?
I think in terms of training, haploidentical is a relatively newer form of transplant. As I understand it, the research really was established in the early 2000s. I think in terms of training and learning, there's tons of research that's out there online and in different, literature search portals. But there's also the Health Resources and Services Administration, or HRSA, that has a page specifically for blood stem cell. And I think that that's an incredible resource because they also have information specifically on transplants within the BIPOC community, including up-to-date data on the number of members of the BIPOC community within the donor pool. There's also the National Marrow Donor Program. That's a wealth of information and community activities, as we were talking earlier, in terms of getting the word out as far as donation. They're a great source of information as well. And then another reference that I like to refer nurses to, particularly new nurses who are just beginning in transplant, is the Oncology Nursing Society's Hematopoietic Stem Cell Transplantation Manual. It's an excellent, excellent reference for anyone who's interested in stem cell transplant, not just on haplos, but on the whole gamut of the transplant world. And so I recommend that to all new grads that I precept or students that I precept. And there was actually a new edition that was just published last year that I would refer any nurse to. So yeah, I think those are really the major resources. I don't know about specific training. There's the BMTCN, or the Blood and Marrow Transplant Certified Nurse, that ONS has made available as a certification. And I think that that's also a great way to learn more about transplant and to get certified and recognized as an expert in transplant.
Yes, those are all really good points. So, nurses wanting to know more about the certification that you were just talking about can go to the ONCC's website and get information about that, as well as finding the test blueprint so they would know kind of what things to study to take that. But that is an excellent suggestion for nurses who are in transplant or looking to go into transplant to be able to show their expertise in this specific specialty area. Naomi, I want to thank you for all the great information that you've been able to provide for us today. It's been very insightful and very helpful, especially for folks who might be new to transplant or maybe that are in an area that they may send their patients frequently to transplant programs. I think this is a really great way for them to understand a little bit more about what is happening with their patients and be able to talk to them more. And like we kind of said earlier, just to feel a little bit better about the fact if they know their patient is headed to get a haploidentical.
Absolutely.
To finish us up, I have a couple questions that I would like to ask you that I kind of try to end all of our podcast on. And the first one, you kind of touched on it just in this last question I asked you about training, but Are there any other resources that you would recommend for clinicians as well as for patients and caregivers? I don't want to forget them because it's important that they understand what all of this is about, and specifically from the BIPOC communities.
Yeah, I think a great resource for members of the community who want to learn more is the National Marrow Donor Program, because what's great about their website is that they don't have information just tailored to clinicians, but they have a specific web page that's tailored to information for patients and caregivers. So I think that they're a great source of information. And then there's also the American Society for Transplant and Cellular Therapy, or ASCTCT. I think I got that right. They're also an enormous resource for information, training, community resources specifically to the world of stem cell transplant and cellular therapies. So I think that that's also a great resource for clinicians and caregivers and patients to tap into.
Thank you. My next question for you: what are common misconceptions about haploidentical transplants?
I think, as we mentioned earlier, the biggest misconception is that it's more complicated and less effective. And as we talked about earlier, in terms of the research, that's shown not to always be the case. And so I think that's one huge misconception that I'm glad I have the opportunity to help clear up.
Okay, my last question is: what's something about haploidentical transplants that's not often discussed but you wish people knew more about?
I think the cytokine release syndrome is really the biggest complication related to haplos that I don't think is discussed much or really published much on in the nursing literature. I really learned about it just through personal experience working with these patients. That's definitely something that nurses, particularly, would benefit from knowing more about.
I appreciate you saying that because I agree. I think that is something that is definitely not common or that you would expect, and that is really a great piece of information for folks to know and understand. And I just again want to reiterate how much I enjoyed having you on today and the information you've given us, how valuable it has been. Do you have any final comments for us?
No, I just want to thank you for having me on and giving me the opportunity to talk about haplotransplants and other transplant alternatives for members of the BIPOC community. And yeah, I hope I inspire others to learn more.
I think you definitely will. Thank you so much for joining me.
Thank you, Stephanie.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.